As a dentist, what toothpaste do I personally use? Stick around, and in this video I will share with you what are my personal choice of 3 toothpastes that I always use and always have in the cupboard. And as a bonus, I will also mention the only whitening toothpaste that I have recommended the last 20 years of professional dental practice and still do. The 2 most common questions I get from patients when we discuss toothpastes are, what is the best toothpaste to use? And the second question is, what toothpaste do you use, dentist? Considering that you might use up to 600 tubes of toothpaste in your adult life, you will be brushing 70 full days of your life away. That equates to about 1 full 24-hour day per year that you will be continuously brushing your teeth per year. Then all of a sudden, toothpaste and what is in a toothpaste, how much you spend on a toothpaste, takes on a whole new meaning of why it is an important conversation topic. As a disclaimer, I just want to mention that this video is for some educational purposes and maybe some entertainment if some of you would find it entertaining to hear a dentist talk about his own preference of toothpaste. But at the end of the day, you will have to be advised by your dental healthcare professional, your dentist or your oral hygienist as what would be the correct toothpaste for you. History tells us that the Egyptians were the first documented race that concocted some form of dental tooth powder. And over the past millennia, we as humans have manufactured toothpaste containing mud, sand, ash, different oils, barks from trees we used as toothbrushes, and we have even used radioactive material in toothpaste in the 1920s. I kid you not, go Google that. Modern toothpaste as we know it today appeared around the 1800s, and we have today what we call active ingredients and inactive ingredients in toothpaste formulations. I consider all ingredients active because if it didn't serve a purpose, why would it be in toothpaste in the first place? Apart from fluoride, of course, toothpaste contain desensitizing agents, tooth whitening chemicals, and other antibacterial and other antimicrobial pharmaceuticals. Also contain foaming and soaping agents, usually SLS, sodium lauryl sulfate, and other exotic chemicals specific for the indication and need of that specific brand and formulation. Apart then from fluoride, let's discuss some of the other active ingredients and lay the foundation of what is in toothpaste and how I deduct and come to a conclusion what I prefer to use personally. As most people are aware, the main ingredient in a toothpaste would probably be fluoride. You get different varieties of fluoride and they are categorized under the inorganic fluoride types, and that is sodium fluoride, sodium monofluorophosphate, and then the stannous fluoride, also called tin fluoride. Very few people are familiar with an organic type of fluoride, and I will mention that in a few moments. At the end of the day, we can, as a general comment, say that all fluorides are more or less equal, and science supports the idea that irrespective of the type of inorganic fluoride, all fluorides are absorbed roughly in the same amounts or concentration, not necessarily always in the same amount of time or uptake, but we can agree that all fluorides, inorganic at least, are equal. The advantage that stannous fluoride or the tin fluoride has is it has been proven that it has extra antibacterial and antimicrobial activity on top of the fluoride action, which the others do not necessarily exhibit. A typical example of a stannous or a tin fluoride would be the type of fluoride that you would find in the Oral-B range of toothpaste. The only organic fluoride is a component known as fluorinol, and that is manufactured by a very large, well-known pharmaceutical and cosmetics company in France, Pierre Fabre, and I will mention that a bit later in the video. The science also supports that the organic fluoride or the organic fluorinol then manufactured by this specific company does show an increased uptake of 4 to 6 times better than the inorganic fluorides as mentioned before. Do remember to check out all the links down in the description, as I will link some of these studies and the specific toothpaste that I discuss in detail down below in the description. Debate about fluoride or fluoride free totally falls outside the scope of this video and the discussion for today. I am personally, as a dentist, very supportive of a patient that do not want to use fluoride. Hell, it is a free world at the end of the day, and you are an autonomous individual and patient that should be granted the liberty to choose for yourself. But there is a caveat. If you are going to be fluoride free, the oral hygiene should be above impeccable, and the diet of you or the patient should be above impeccable. What's the definition of impeccable? Well, again, that's something that falls outside the scope of this video, but I think you do get the point. So, what framework do I apply when I choose a toothpaste for me as a dentist? First of all, I will have to look at what is called the RDA. That is not the recommended daily allowance as you would find on medicines or vitamins, but that is the relative dentinal abrasion. I also look at the fluoride, or if it does not contain fluoride, and then I will consider the active ingredients and what specifically I find added value to my life. The main consideration when I choose a toothpaste starts with the RDA. RDA is not the recommended daily allowance that you would find on a medical or medicine insert or on a vitamin package, but that refers to the relative dentinal abrasion. Relative dentinal abrasion is on a scale of 0 to 250, where 0 is basically nothing in terms of abrasiveness, and 250 would be the upper limit of safety. The FDA, the Food and Drug Administration in America, says that up to an abrasiveness of 200 is allowed. However, the American Dental Association says that up to a limit of 250 is allowed and safe according to their regulations and advice. For example, if you were to use a toothbrush with just water, the RDA value would come in at around 4. If you were to add baking soda on that toothpaste and water, the abrasiveness goes up to about 7. My theory and argument is that if a scale goes up to 250, why would I choose the upper limit of the abrasiveness, the grinding, the damage potentially to my teeth, if I could get away with something of an RDA value of 10 or 20 or 50, or at least below 100. Something worth mentioning on the topic of abrasiveness then is also when one looks at the whitening toothpaste. Some of the whitening toothpaste, especially the ones that you will be buying commercially in the shops and not specifically at your dentist as a professional toothpaste, has a very high abrasive index, meaning that the RDA is very high because the whitening effect is not given through the action of chemical agents in the toothpaste that you would be able to buy on the shelf, but rather the abrasiveness of the toothpaste will whiten the tooth as it polishes and grinds away. In my mind, again, as a dentist, it should be about preserving and maintaining oral health, and the idea of something very rough and coarse abrading the superficial tooth structure doesn't sit well with me as a dentist. There is, however, gentle, chemical, organic, and biological components with a very low RDA value that is available in some of the whitening toothpaste, and of course that will be mentioned in a few moments. Sensitivity and some other special active ingredients is worth mentioning as you go through the process of discussing this with your dentist or your oral hygienist. Potassium nitrate is a well-known chemical that is used in a lot of the desensitizing toothpaste, especially the well-known brand of Sensodyne. And Colgate Pro Sensitive Relief is another desensitizing toothpaste which has arginine as the active ingredient for the sensitivity. And then in terms of other sensitivity or desensitizing toothpaste, again back to the familiar brand of Sensodyne, there is a bioglass with very high-tech properties in one of the toothpaste called Sensodyne Repair and Protect. And the active ingredient in this is calcium sodium phosphosilicate is the active ingredient bioglass in the Sensodyne Repair and Protect. Just some concluding remarks about fluoride before we go on to my list of personal preferences. When one needs to consider fluoride, one should also consider if you don't want to use fluoride. If you consider using fluoride, the question will then be organic or inorganic fluoride, and then it would also be how much fluoride do you want to use. Notwithstanding the lower concentrations of fluoride, especially in the junior or the children's toothpaste, most commercial brands will have some form of toothpaste specifically for kids that will automatically have a lower concentration of fluoride. I have found, looking back over my years as a dentist, that in the past 20 years, the concentration of fluoride has increased. Back when I studied more than 20 years ago, it was very common to find a toothpaste commercially available that would have less than 1,000 parts per million of fluoride. Again, I'm not referring to the kids or the children or the baby toothpaste. I'm referring to adult toothpaste. And nowadays, it seems that it is very difficult to find an adult toothpaste commercially that has less than 1,000 parts per million, as most commercial toothpaste at this point in time will have 1,100 or 1,200 or even 1,450 parts per million of fluoride in them. This is important just to say, because later I will be discussing a very specific toothpaste I use that has a very high concentration of fluoride, and some people or colleagues might criticize me for mentioning or recommending this toothpaste because of the high levels of fluoride. But as mentioned, I do notice and have observed in the past 20 years that fluoride, for some or other reason, has increased in concentration or value in toothpaste. Feel free to comment down below what your thoughts are on this. Thus, based on the RDA, the abrasiveness, the fluoride or no fluoride, and some other active ingredients, let's have a look at what my favorite toothpastes would be as a dent for myself, recommended for myself. If I could use only one toothpaste for the rest of my life every day, it would be a toothpaste manufactured by the French company Pierre Fabre, and that would be the Algidium range of toothpaste, and more specifically, it would be the Antiplaque one in the range. Please note that the Algidium, as mentioned, is the only range or company that manufactures the organic fluorinol fluoride, but the Algidium Antiplaque is a specific fluoride-free toothpaste. The fluoride is substituted by calcium, and one of the other active ingredients contained in this specific toothpaste is chlorhexidine at a daily usable concentration of 0.004% chlorhexidine. Chlorhexidine has always been regarded as the golden standard of antibacterial and antimicrobial action in dental products, as well as in medical and other healthcare products. The Chlorhexidine and this specific toothpaste has, in my experience for myself and for patients, been the only toothpaste that I consider able and effective to make a dent in anybody's complaint of halitosis and bad breath. That is probably due to the action of the chlorhexidine. Just commenting on the RDA, as I said, that would be one of my first and primary considerations for a toothpaste. The Algidium Antiplaque comes in at an RDA value of 65, well below 100, and very far away from the 250 upper limit proposed by the ADA and the 200 of the FDA. So I'm very comfortable in the abrasiveness level of 65 exhibited by the Algidium Antiplaque toothpaste. Before I move on to my number 2, it is worth mentioning that the RDA, the relative dentinal abrasion, is never mentioned on any of the packages. I will post a link in the description of a chart I found on the internet that does list some toothpaste with their relative abrasional qualities, but the only one toothpaste that I have discovered thus far that actually puts it on the label comes in at number 2 for my own personal use and personal preference is, drumroll, comes in at number 2, and that is a brand that is very difficult to pronounce. It is Yo to Hell. Yo to Hell. And of course, there will be a link down in the description. They have a variety of toothpaste in their brand, and the one that I prefer to use is the golden one. The box is golden, and it is the Farmer B5. This is, as I mentioned, the only toothpaste that publishes on the packaging the RDA value. The RDA value of this one comes in at, drumroll, this is also the lowest one that I was able to find on any toothpaste, 36. I mean 36, that is very low. This toothpaste does contain fluoride. It also contains a non-nutritive sugar called xylitol, which has also been shown conclusively that it has a myriad of antibacterial, antimicrobial, antifungal, antiviral properties. Because it is non-nutritive, it really supports good dental health. Another fact worth mentioning with this number 2 on my list is this product does not contain SLS, sodium lauryl sulfate, as mentioned earlier. Sodium lauryl sulfate is a soaping and foaming agent. It tricks your mind into believing that, oh, this foams a lot, it must be working. So when you use this toothpaste, just be aware that it might feel in the beginning that it doesn't work, it doesn't foam, this is rubbish. But again, coming back to this toothpaste and the other active ingredients, this toothpaste then also is a whitening toothpaste, but it doesn't have chemically active whitening ingredients, but it has biologically active enzymes used to bleach the tooth, and also then, as mentioned, with the low RDA value, nothing abrasiveness is brought to the table in terms of the whitening effect of this toothpaste. One last thing worth mentioning, not specifically related to this toothpaste, but in SLS in general, a lot of patients that suffer from chronic mouth ulcers and after usually have a sensitivity to SLS, and it would be advisable to check what other toothpaste you could find that does not have SLS in them if you do suffer from chronic mouth ulcers. And coming in at number 3 on my list of preferred toothpastes for myself individually, not recommended to you, but before I continue with the name of this next toothpaste, it should be worth mentioning that this is a very special toothpaste, and if you want to use this toothpaste, it should definitely be discussed with your oral hygienist and or your dentist. Most of the time, this toothpaste is only available on prescription. I have yet to find it commercially in shops. You might be able to find it on the internet. This toothpaste is specifically indicated for very high risk caries patients, elderly, people with dry mouth that will again develop caries very easily, people or patients with special needs that need added fluoride to their daily regime, and also people that already, or patients that already has a lot of demineralization, again falling into that high risk caries susceptible individuals. Although this toothpaste may be used daily in the morning and in the afternoon by these specific individuals that require this toothpaste, I do not fall into the category of any of the special indications listed. So I do not use this toothpaste daily, which is important to note, but I use it maybe once a week or maybe once a month as an added top up to fluoride and remineralizing, giving my teeth a dental facial mask, if you want, in terms of the fluoride content. And drum roll for the toothpaste with name Colgate Durafate. So this one might scare off a lot of people because of the high content of fluoride, but like I said, I just use it as a top up once every so often, but it is definitely worth discussing with your healthcare or your dental practitioner if you fall into one of the mentioned high risk categories. Concluding the list of my top 3 then, I still would prefer, as I've mentioned, if I could choose only one toothpaste for the rest of my life, that will definitely be a fluoride-free toothpaste, and it will be none other than the Algidium Antiplaque specifically. As an added bonus to this list, I mentioned that I will say a few things about whitening and whitening toothpastes. As mentioned already, my preferred toothpaste number 2 on the list, the Yotel Farmer B5. Where is the golden box? The light is very bad. The Farmer B5 with the low RDA value. There is another one, and that is a very well established, in my opinion, and you are free to correct me in the comments. It is probably the biggest, best and well established whitening brand in the world, I think, and that is made by a American company with the name Ultradent. Opal Essence is the brand, and Opal Essence also makes a toothpaste, a Coolman. The light is reflecting. Let's try the box maybe. Opal Essence is the brand. Links will be down in the description. And this toothpaste also contains fluoride, but it has a relatively low dental abrasion. It is 90, and again falling below the 100, which I would personally see as a safe abrasive level. Furthermore, it does contain SLS, so you will get that nice foamy effect from what you're probably used to from your ordinary commercial toothpaste. And this toothpaste then is also indicated as safe for a daily use. Of course, it can be complemented with the bleaching from the same company if you source that or buy that from your dentist or your oral hygienist, but this toothpaste would already make a significant improvement in your whiteness of your pearly whites if you were to try this and not go for the more expensive whitening kits, perhaps. That concludes my list of top 3 or maybe top 4 toothpaste then. Please comment, like, subscribe, and check out the links down in the description. See you next time.